Hello everyone, good evening. I'm Priyanjali from Bladder Wellness team. I'm sure all of you must be keeping good health. Today we are discussing a very important topic which is benign prostatic hyperplasia or what we commonly call as BPH. Benign prostatic hyperplasia is the non-cancerous enlargement of the prostate that usually begin in 50s in men and cause obstruction to urine flow. Many men have to wake up in the middle of the night and go to urinate, which is the most troublesome aspect of this condition. A doctor, such as a urologist, can treat this condition and help his patient get relief. To educate us more on BPH, its diagnosis, treatment, and prevention, we have with us Dr. Manish Kumar Pandey from Navoday Nursing Home, Bhagalpur, Bihar. Dr. Manish Kumar Pandey, MBBS, MS, FMAS, FIAGES, FCLS, Senior Residency AIIMS Delhi, is an ex-assistant professor from AIIMS Bhubhaneshwar and has rich experience in the field of urology, laparoscopy, and gastro surgery. He has performed various critical surgeries and treated his patients with utmost care. And with that, we would like to welcome डॉक्टर टू today's platform. Our first question, doctor, for you would be एक बार अगर आप अपने language में हमें बता पाए, what is BPH?
As you already mentioned, BPH is benign prostatic hyperplasia. Usually, our prostate gland is situated below the bladder at the outlet of the urinary stream. After the age of 40, it usually increases in size. Usual weight is 18 grams, but after the age of 40, it increases in every person. But not many of them have any symptoms. But few of them or some percentage of the people have symptoms of BPH, or that is due to the enlargement of the prostate. They can have many troublesome symptoms, like one of already mentioned in the introduction, that patient may have frequency of urination, that he will require to go to the toilet again and again, especially at night. This is the first symptoms patient usually come to us, and they will tell that the urinary stream, that is force of voiding, is getting lengthier and lengthier. Difficulty in force is getting more and more while voiding, and he is taking more time to void the urine. Third symptoms may be there may be burning of the mutations. There may be hematuria, that is blood coming per urethra. There are other symptoms like patient will not be able to hold the urine when urge occurs, and also there will be a feeling of incomplete evacuation of urine. These are the common symptoms with which BPH patients usually present to the clinicians. And then accordingly, we will investigate, and then we will go for the treatment, medical or as per required surgical therapies.
Right, right. Doctor, you mentioned the symptoms, which we would definitely ask you in future, but you have already mentioned about the symptoms, about the early symptoms. But if we compare these symptoms with the symptoms of a diabetic patient, aren't the symptoms almost similar? How do we differentiate between the two?
Few symptoms are similar, like frequency of micturition, that is urge of going to the or to urinate more frequently, is also present in diabetic patient. But in diabetic patient, there is no poor streaming of the urination, and there is also precipitancy, that is non-holding of the urine when it urges. It usually do not occur in patients with diabetes. Usually, the patient with diabetes will only one symptom, that is burning micturition and frequency of micturition. Other symptoms will not be present in cases of
Right, right.
diabetic patients.
Right, right. Well, doctor, now that we know the symptoms already, can you tell us what is the reason behind this condition? We are not calling it a disease because BPH is not a disease. We know it by now.
Yeah,
What can be the cause behind it? Yes.
it's a physiological changes occurring in the body, that is due to the down after the age of 40, the testosterone levels of the body decreases, and that lead to the increment in the size of the prostate. Usually the size of the prostate do not correlate with the symptoms of the prostate, In many people,
Hmm.
there are larger size will cause no symptoms, and in many people, even slight increase in the size will cause the symptoms of the BPH. There is no such other
Right.
cause like any food habit or anything physical activity. It
Hmm.
does not lead to any such or any genetic cause, but it is a physiological changes that occurs in the body. But in some people, it presents as symptoms of BPH, and that will require the treatment.
Right. So we are saying that genetics also has nothing to do with it.
No, no, it's not usually a genetic or any hereditary causes are not associated with the disease or the symptoms of the BPH are not associated with that.
Right. Moving ahead, doctor. Age is one of the major factor behind it.
Age is a
So
factor, yeah.
just like राइट राइट जस्ट लाइक हम अपने बालों की सफेदी को नहीं रोक सकते हैं हमारी स्किन में रिंकल्स आना हम नहीं रोक सकते हैं आजकल बहुत सारे ट्रीटमेंट्स अवेलेबल है ऑफ कोर्स बट देन देयर विल बी अ पॉइंट ऑफ टाइम जब आपके स्किन में वो शो करेगा फॉर श्योर तो वैसे
Yeah,
ही
yeah,
आज हम कह रहे हैं वी आर सेइंग दैट प्रोस्टेट इज समथिंग जिसे हम रोक नहीं सकते हैं ये विद
needed.
एज एट एनी पॉइंट ऑफ टाइम दिस कैन अकर डॉक्टर डायग्नोस कैसे करते हैं हम इसे कैन यू प्लीज इलैबोरेट इट फॉर अस
Yeah. The initial diagnosis, first we take the history of the patient. They will give the complaint like we have already mentioned. Then we will go for the as per any for any patient we take the history. We take the past history whether the patient is having the history of diabetes or any other disease or not. Then we will examine the patient, and in the examination of the patient, the most important examination for this patient is per rectal examination. In the per rectal examination, we put our finger inside the anus of the patient and we feel the prostate gland, and it will, as per experience or clinical experience, we can differentiate that it is a enlarged prostate, mildly enlarged, moderately enlarged, or severely enlarged. And while doing that, we can also assess all many other things like is there any nodule, there is firmness or hardness of the prostate. We can assess that also, and then we will go for a uroflowmetry and ultrasound examination to confirm our diagnosis after doing the examination, and the most important blood test that we do for any prostate patient is that is serum PSA level. These are the clinical examination, serum PSA level, and ultrasound of the KUB region, kidney, bladder, and uh, uh, ureter. That is urinary system ultrasound will define or confirm our diagnosis.
Right. Doctor, initially we have spoken about diabetes. So, does this condition look a little different for the diabetic patients or say thyroid patients?
No, no, it is not
Can it
associated
be
with.
a little difficult? I mean to say.
Yeah, yeah. No, it's very difficult to say that it's associated with that thyroid or any diabetic patient. There are non-diabetic patients who are also having the same percentage of patients we see that are having BPH,
Hmm. Right.
and they are good in the
Speaking of
diabetic.
doctor, medical sciences has evolved drastically, and we know that there are a lot of treatments which are available for BPH nowadays. And in fact, we see patients getting cured in 1 2 days. So, can you please elaborate the treatment procedures? What do we opt for first, and then how do we move into the surgical phase?
Yeah, we start initially with the if you first we assess whether the patient requires any treatment, any of the treatment is not. We will assess the symptoms. We will grade it according to the. There are many scales of grading those symptoms. That is not for the
Hmm.
general public to know
Right.
to know more about.
Right.
They will not understand this, but we
Right.
will grade according to the symptoms, and according to that grading we will prescribe any medication. Start with medications. There are so many medications now available, and initial treatment is given by the medications. Then if the symptoms do not improve by medication, or if initial assessment or the patient come late to our clinic with
Mm-hmm.
certain conditions like having retention of urine, hematuria, recurrent infection, or or they are already having any obstruction leading to the disease or any derangement in the function of kidney. After assessing with uroflowmetry and other examinations, if the patients come with minor symptoms, we will start with the medicinal therapy get relieved of the symptoms for many years. If the patient come with urinary retention or have massive hematuria or recurrent UTI, if the patient come with those symptoms, then we will have to think about going for the surgical treatment for first hand. Otherwise, we will start with medicines that are available all over the counters.
Right. So we are
Yeah.
basically saying that medicines are the in the first cases is what we trust on, and most of the cases we see that the patients are cured with medicines itself until and unless
Yeah.
you are prolonging your disease. We'll also talk about this, but again coming back to the medical procedures, doctor, what are the surgical procedures which are available if our patients or our viewers would want to know that?
Surgical options are to start with. Initially, a long time ago, only open surgical methods were available. That we used to open the bladder and inoculate the prostate gland, and that was the treatment. But nowadays, non-invasive methods are getting popular. That is first one of the TURP, that is transurethral resection of prostate. In that method, a cystoscope like a is telescopic method. We go inside through our urethra up to the prostate, and we dissect or we just peel off the prostatic glands. That is the method that is usually done by cautery. Nowadays many laser therapies are available that can that has made the process more easier, and more bigger prostates can be taken care of by laser therapies. Polonium laser
Right.
is the one of the laser that is used in these cases of benign prostatic hyperplasia, and that give very good results and without with minimal cost of morbidity and hospital stay.
Mm-hmm. So, because you mentioned this, doctor, the main issue because we don't visit a doctor is we are scared of the treatment. May it be medicines, may it be surgery. We see patients are normally scared. सभी को लगता है कि अपने आप ठीक हो जाएगा. But
Yeah.
as doctor is already mentioning, doctor, कितना वक्त लगता है normally from hospital to walking back home? How long does it usually take for the patient?
Usually, even for medicine therapy, patient has to go to the clinic and they get prescribed medicine and they go home. But if the surgical therapy is advised, initially when
Hmm.
open surgery was done, it took 1 or 2 or 3 days maximum in the hospital stay. But nowadays this is a day care procedure. Even the patient go to the clinic, get operated in the morning and can go home in the night. More if some patient has some comorbidity or if the more monitoring is required, then he can go on next day. He can be discharged on the next day. It is only 20 matter of 24 hours that patient can come, get treated, and get go to home. And
Right.
even
It's that
after 2 3,
easy.
yeah, then after 2 3 days and within a week he can join his duties also.
Right, right. Well, it's that easy, just like it sounded from doctor today. But doctor, if we speak about medicines, how long do the patient need to carry the medications for?
Medicines are usually prescribed, and dosing is only once a night. All of the
Hmm.
prosthetic medicines are very easy to take because dosing is very simple. It has to be taken after meal in the night. So it has no multiple dosing of any of its drugs. So it's very easy to take the drugs in the night and after coming from offices or after work, after having dinner, and take it in the night. And that
Right,
medicine usually takes 3 to 6 months. We give the therapy, and if the symptoms improve, we can stop the medicine and see whether the symptoms recurs or not. If it recurs, then we can also extend the treatment. But if the recurrence is far more frequent, then we will go for the surgical treatment.
Right, right. Two things you mentioned here, doctor. Reoccurrence, we will know about this. Let's know about the medications first. Are there any side effects for the medications?
What?
Are there any side effects of the
Yeah,
medications
yeah,
which we normally
yeah,
prescribe our patients?
yeah, yeah, yeah. Certainly, every medicine has some one or other side effects. Usual symptoms of
Hmm.
these side effects are the dryness of mouth, and some patients may feel drowsiness or postural hypotension. That is, may get hypotensive after taking the medications and may feel heaviness in the head and may feel blackout and may fall. So we usually prescribe these medicines in the night so that while doing going for the
Right.
work, we do not feel these symptoms. And if any of
Hmm.
the side effect occurs, it does not cause any harm to the patient.
Right. Also, doctor, there is also a belief among the patients that the medication somehow can, disrupt the function, disrupt the sexual function of the patient. Is it possible?
Yeah, initial some non-selective medicines that was given that also act on the prostatic gland, also on the our uh, those glands which are necessary for our sexual functions. But now the more selective drugs are used and that are not
Hmm.
causing any of such uh, concerns.
Right. This is the only reason why we always suggest our viewers, our patients, that please do not self-medicate. We will also know about
Yeah.
this from doctor today. Doctor, let's talk about reoccurrence now. What is the rate, what the current rate of reoccurrence after surgery?
Surgery as such, surgical recurrence will not happen, but
Hmm.
it depends upon the expertise of the surgeon. Initial, those surgeons who have just completed their uh, training, they usually do not remove all of the prostates, fearing that it may cause there are certain complications of the surgery. Fearing the complications of the surgery, they usually do not inoculate whole of the prostate. But the recurrence depends upon the experience of the surgeon, and sometimes in
Right.
the patient's volume of the prostate, initial volume of the prostates, and more it depends upon the expertise of the surgeon. If the surgeon is experienced enough and he has done this surgery with good instruments, like nowadays laser is available. If it is done with a good surgeon or experienced surgeon with good instrument, the chance of recurrence is less.
Well, that was for our viewers. That please choose your urologist wisely. Just like we always say that please choose your medications wisely. You should also choose your doctor wisely. This is also what we are suggesting our viewers today. Doctor, speaking of medications, we see self-medication has been highly uh, taken by all our patients nowadays. Either they will get a suggestion from their near and dear ones, or they'll visit the chemist. The chemist will give some sort of medication and then they start using it. So, how can self medication be harmful in the case of BPH? If you can let our viewers know.
It should never be taken without advice of a doctor, because there are
Hmm.
many group of medication and many of the patients, and it also tailor made for the many of the patients according to the age and their comorbidities. And if it is taken without consultation of the doctor, it can cause a lot of harm to the patients, because there are certain complications that are very dangerous for the patients. So it should never be taken without the consultation of any expert of this uh, treatment of the BPH, or the urologist, or the general surgeon, or any physician.
Right. Since the beginning of today's session, doctor, we are hearing one thing that if the patient comes to us in a bad situation or a bad condition, so what are the worst scenarios if the patient is prolonging this condition?
If the patient does not take the treatment properly in time, it may lead to the kidney failure. That whole of the chronic kidney disease can develop. Patient will go for have to go for dialysis for the, or there may be the permanent damage of the both the kidney, and that will require uh, a regular dialysis or even renal transplant. This is the worst situation that any patient can have to face if do not get treated
Right.
symptoms of the BPS in time.
Right. Doctor, you also mentioned UTI. So, are there chances of the occurrence of UTI for the patient of BPH?
Yeah, BPH patients usually have more UTI because there is stagnation of the urine in the bladder. Usually, he is not able to pass whole of the urine that is collected in the bladder, and we all know that any stagnant fluid has more chance of getting infection. So,
Hmm.
patients of BPH are more prone to urinary tract infection.
Right, right. Speaking of that, doctor, water has a lot to do if we are talking about UTI. So, how much water do we normally ask our patient to consume if they have a normal, regular lifestyle? Because water intake depends on the kind of lifestyle you are living. We know that. So, how much water is recommended for the patients?
For any like any patient, BPH patients are also recommended adequate amount of water, that is 2.5 liter to 3.5 liter for a average weight patient like 60, 70, 80 kg patient, adult requires 2.5 to 3.5 liters of liquid water or liquid in any form in 24 hours.
Right, right. And is there any connection with the diet? Any do's and don'ts if the patients would want to know that?
BPH usually is not associated with any of the dietary habits. It has not been shown to be associated with any dietary habits. It is
Right.
aging process. In the process of aging, sometimes the prostate glands that increases in size lead to these symptoms due to so
Right.
many
Right.
etiology is not very known.
Right. Also, doctor, are there any triggers like change in lifestyle habit or intake of alcohol or smoking, which can somehow trigger the condition?
No, no, even these things have not been associated with the symptoms of the BPH.
Right. Right. So
Neither food,
basically,
neither lifestyle.
what about stress, doctor? We know that stress has a lot to do with a lot of disease, a lot of conditions. So any correlation between stress and
Stress,
BPH?
as such, it is not associated with the BPH, but stress can also have the symptoms like BPH.
Okay. Okay. Right.
Usually frequency of micturition and symptoms like that. Stress can cause any symptoms in the body, and that also is true for the symptoms of BPH.
Right. What about physical exercise, doctor? Do we recommend the exercise for the patients who has been through the surgical procedure or the patients who are into medications?
Physical exercise and exercise is good for every part of the body. If you do good
Mm,
exercise, physical exercise, if you are healthy, our every system is healthy. So exercise is always good for any sort of patients, if not
right,
contraindicated.
right. Speaking of exercise, any particular exercise which the patients can, include in their daily regime?
There are not certain, depending upon the age and other physical condition of the patients, they can take advice of any physiotherapist or any expert of that field that can they can guide them for any such of exercises. But there is no specific exercise we prescribe for doctors for the symptomatic relief of the BPH.
Hmm, hmm, hmm. Right. With that, doctor, I can see a few questions coming from the viewers. The first question is been asked by Palkesh Mehra, who asks, "What is the role of prostate-specific antigen or PSA test in BPH?"
PSA test usually indicates the it is not confirmatory test, but it suggests that patient may have carcinoma prostate. It is an indicator for or indicator to rule to further investigate whether the patient is having carcinoma of the prostate or not. Because the patients with the carcinoma of prostate will present with these symptoms of the simple BPH. But if the serum PSA is more than 10, if it is between less than 5, it is not usually not associated with carcinoma. 5 to 10, it is doubtful. If its level is 10 more than 10, then we should further investigate those patients to rule out carcinoma prostate before going for further treatment.
Right, right. I believe, Palkesh, you have got your answer. The next question, doctor, comes from Ankan Basu, who asks, what is the cause of chronic bacterial prostatitis for the young male? Despite taking antibiotics for 6 months, it's not being cured. Can injection antibiotics completely cure it? Is it safe for body?
First thing, the cause can be the hygiene. If anybody is not keeping hygiene of his genitals, then there is chances of getting infection and urinary infection, and that to the prostatic infection. Usually, the treatment does not depend upon the injectables or the oral medications. Usually, if the
Hmm.
patient has having a UTI, we get the urine culture done, and if the drugs those are sensitive, or the bacteria that has grown up, if it is sensitive to any of the drug, either whether it is oral or injectable, we can give and get the good result out of it.
Well, the next question, doctor, comes from A. Raju. I think we
Urine
have
culture
already
is
talked about
needed.
this. Right, right, right. All right. Doctor, the next question comes from A. Raju, who asks, what are the potential side effects of BPH medications? We have already talked about it, but in case if you want to mention it once again.
Yeah, we have already mentioned that there are alpha 1 blocker drugs that can cause the dryness of mouth, coughs that may lead to the dizziness or the syncopal attack, like blacking out and getting hypotensive event. On standing, there are chances of getting hypotensive events that will lead to the blackout, and while lying, we can get relief of those symptoms. Otherwise, now the medicines are more specific and more targeted therapies. These new medications have very few side effects.
Right, right. Doctor, we had a wonderful discussion on the topic today, and it was very informative for our viewers. Before we take a leave, any take home message for our viewers who has watched us so far?
Yeah, any elderly who is more than 40 years age and having those symptoms which we have already discussed, they should certainly, as early as possible, consult their urologist or the physician and get evaluated for the symptoms of the BPS, and if needed, get treated. Otherwise, they may land in many other further complicated situations. So we can just say that if the symptoms occur, or if we have learned those symptoms, for those who have heard these discussions, they should also be aware. And if anyone, their friends, family has any such symptoms, they should just go and consult their urologist and physician.
Right. Well, that was expert advice for today, and that was Dr. Manish Kumar Pandey for us. Thank you so much, doctor, for your valuable time. It was quite an informative session, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.